Okay, we've got purple again, A53. A53, woo! I already showed you. You can take that and go there. Thank you so much for your support. Okay. Now back to business. The next speaker, I have to be really nice to. This is Mark's boss. So I say he's incredible. Andrew Mao, and you can read about him in the bio, but Andrew will be talking today about healing addiction and trauma through structural dissociation and models of the mind. Wow, it's very intense. I'm very interested to hear about that and understand what that is, really. But I would like to tell you a fun fact about Andrew. He is actually a black belt in Brazilian Jiu-Jitsu. Yeah. So don't get on his bad side. He also helps out. The instructor instructs classes sometimes. But an incredible fact that I have on really good recommendation: he makes amazing pan-fried dumplings. So book in for a meal with Andrew. So please welcome Andrew up. Thank you, Andrew.
Hello. Can I just start by, I'm going to talk mainly about addiction. Can I just start by checking, are there people here who look after people with addiction? What about people who are in contact with people with addiction, either within yourself or... Okay. So I'm going to sort of speak conceptually rather than clinically, I think. So we have our made-up patient Maddie that Libby actually introduced to us, and then, Mark introduced to us as a 6-year-old diver, and then Libby continued as a 17-year-old athlete, I think a professional athlete, and we're going to just continue a case study. So Maddie's now 35 years old, and she has come with a loss of licence. There's a workplace conflict. She says she's been bullied. She's separated from a partner and 2 sons. Over the last few years, she's had 2 miscarriages. Child Protection Services have contacted her. She's had an emergency department visit for a witness seizure. And Maddie's mum passed away 6 months ago. So Maddie comes to me anxious, agitated, and defensive. She's focusing on what's going on outside of her life. And she's become numb and robotic. She's not feeling a lot, despite all of these things that have happened over the last couple of years. Maddie says she's been drinking 1 bottle of wine daily. She tells me she needs it to relax. There are morning tremors, so when she wakes up, she starts shaking, unless she drinks. And she started to drink in secrecy, so she's hiding it from work and family. She tells me her alcohol use is a 3 out of 10 problem, and that everyone's overreacting. So my quote, actually this came out, not the way. So, alcohol isn't the problem, it's the answer to another problem. I want you to imagine that you are seeing Maddie, and she's coming to you now with this. And I want you just to share with the person sitting next to you what feelings it brings up for you. I'll just give you a few minutes, and maybe if you can share some of those with me. might come back. Does anyone have any initial feelings towards meeting someone like this or encountering someone like this, or in this state of distress? Does anyone have any thoughts or feelings? She's in a state of denial? Overwhelmed.
Where to begin?
Where to begin? What do we do? Where do we begin?
Sad.
Feel sad, yeah.
One of the ladies said helplessness, a sense of helplessness.
Yeah, helplessness. Feel grief. Are these feelings that you are feeling, or are these feelings you're imagining Maddie is feeling? Any thoughts about that?
Both because she's refusing to feel, I'm unable to feel.
So she's saying, I don't feel anything. But we feel the feelings for her. Something to think about. So these are clinical questions, and some of these have been sort of covered with Andrew. I'm going to sort of segue out of this for a second and talk about addiction. So we live in an addictive society. It's becoming increasingly addictive, compulsive, obsessive. I'm going to give my age away now. So I'm an internet immigrant. So I used to love to watch TV. The show that I loved to watch was on once a week and was always on at the same time. And so I had to wait for the whole week before it was on again. And if I missed it, it's gone. Okay. So now we could think about accessibility and addictiveness. Now you can think that you can binge watch Friends, the whole thing non-stop for 3 days. So you can just keep on watching. So it's now, and now you can watch it at any time. So now it's more accessible, and let's call it at a higher intensity. More recently, because I work in Headspace with Mark, we can think about YouTube and Instagram. So now, not only are the shows on demand, you can doom scroll, so it never ends, and the form is shorter. So the emotional effect for you is much more addictive, and it's quicker, and then your mind moves on. Have you ever had that feeling that I only want to watch YouTube for half an hour, and then it's 2 hours or 3 hours, and you snap out and say, what happened? So now I want to return to the question, who of you have experienced addiction? Okay, so I'm just going to go outside of Maddie's case as well. So we have other mood and mind altering drugs, but for example with alcohol, it used to be you had to go to a pub, it used to be open at certain times, but now you can Uber Eats alcohol. So now you can have home delivery alcohol at any time, at any dosage. Now we've taken away the social aspect of alcohol. You don't need to have a party, a dinner. It can just go straight. You can just order, push a button, and it will deliver. Yep. So these are similar problems with drugs now in the dark web. This is a similar problem with pornography. So the accessibility and the addictiveness of these actions, or these, I'm going to call them addictions. They're not always addictions, but this kind of self-soothing is now accessible instantly. So who of you would panic if you lost your mobile phone? So this is our access to immediate self-soothing. I grew up in an area where we didn't have a mobile phone. You know, if you wanted to speak to someone, you had to go and find this thing that a lot of people probably don't recognise we have to dial it and pick it up. And so now we have instant access everywhere. So our minds have not caught up to be able to cope with the amount of stimulation that comes from everywhere. Addiction is in our society, and now it's normalised. In addition to that, we have some addictive drugs that are incredibly, Dr. Jun would be able to tell us a little bit more about them in the emergency department. So the clinical questions, and some of you are not clinicians, so I won't go into this too much. How do I engage and connect with Maddie? How do I feel about denial and minimisation? In other words, how do I feel when someone says, it's not that bad? And I wonder how you felt when I asked you whether you were in contact with addiction and then you encountered your own experience with, for example, Instagram or YouTube. There's something that's othering about it. It happens to other people. And this sort of leads in with Andrew. Shame is pervasive. Okay, there's a secrecy regarding it. We could think about feelings that arise within yourself with deep shame, the othering of it. It's in you, but not in me. Sometimes we can hold somebody's shame. Maddie's not feeling anything, but we hold. We hold for her. Sometimes we can be angry. It's almost as if, can't you see there's something wrong? Can't you see what you're doing to yourself? Sometimes we can feel frustrated, exasperated, anxious. We could think about, Maddie is a made-up patient, but we could think about early childhood experiences that might be influencing her. We could think about the drowning. We could think perhaps that she didn't get into the Olympics. We could think about her relationship with success or relationship with parents and her relationship with sacrifice that didn't work for her. We could wonder about it. Again, this is sort of clinical, but the essence of this, which is the essence of what I'm trying to get across here, is how do you be with someone? How do you connect with someone? How do you think about your feelings towards them, and how do you use your feelings to connect? Again, as Lauren said, we listen. And, really we probably talk too much, but the ability to listen, to really listen, is, I think, something we all need to work on. We emphasise collaboration and autonomy. In other words, we do it with you. We're together. And the theme of this conference has been about connection. Okay, it's about community. It's about meaning. There are deeper meanings aside from, brief interventional psychological structures that hold us together. And the healing happens there. I work as a psychodynamic therapist, and what that means is that I'm listening in a certain way to clients. I'm listening to the feeling that they might be having. I'm wondering about the feeling they're not letting themselves feel, and I'm wondering, how are they doing that? So Maddie's robotic, so she's doing something to remove her feelings of fear and anxiety and maybe of sadness. We'd wonder, how are you doing that? And so when we return to alcohol is not the problem, it's the answer to another problem. The alcohol is fixing her feelings problem. And it works. It's just not the best solution. When we deal with people with severe addiction, when we deal with people with severe eating disorders, when we sit with people with severe shame, we feel things. The nature of those feelings can become familiar to us. And this leads to what Andrew said. If we can speak those feelings accurately, it allows us to process. If we can't speak about them, they speak us. Libby talked to us earlier on about eating disorders. You could say the body speaks. If you don't have the language to talk about your feelings, if you're unable to talk about your feelings, if you're offline and your body speaks, you will speak. It's just how. Does that make sense? We've thought about Maddie. We've thought about, I want to bring together some of the ideas that we brought up in this conference. So we have schemas, they're early patterns of reacting to painful events. We have the idea of trauma dynamics. And what I want you to think about is that if you think of your first memory, I think Andrew talked about the experience of feeling shame, or let's just use embarrassment. We have carbon dated within us experiences at certain ages and certain memories that haven't been processed and they don't change. One of my memories is the fear of public speaking, which is being triggered right now. The memory is to stand up in front of a Year 10 class and give a presentation where I haven't done my homework. At the moment, if I don't look after myself, I become 16 years old again. Does that make sense to you all? So you could think about, some of you might be students, you could think about exam anxiety. You could think about how it feels. Suddenly you feel young again. It's useful, again, so some of this might be some schema work, but to be able to talk about anxiety. So I've had a number of people help me look after my anxiety prior to this talk. Maddie's grieving. She's avoiding her grief through over-functioning. She's gearing up, but she doesn't have any ability to gear down. Now the alcohol is assisting her to keep going fast. We've mentioned shame and internalised narratives. So what I want you to think about, we're going to imagine, this is a fancy word, but we're not going to use it in the classic way that it is used. We have a body centre within our brain, a feeling centre within our brain, and a thinking centre. In addiction, they disconnect. So if you imagine that Maddie's been pulled over by the police and she's lost her licence because she's drunk a bottle of wine just before driving. Her body has done it. Does that make sense? Her body has picked up the drink and then gone to pick up the children, for example. Her feelings are in a state of numbness, so she doesn't know what she's feeling. Maddie knows that if you drink drive, you're going to lose your licence. So the surprising thing isn't so much that Maddie loses her licence. The surprising thing is that she's shocked she loses her licence. Does that make sense? It's the same thing as being surprised that, 2 hours have gone by on the Instagram. You know, your thinking knows, but your body's doing, and your feelings are doing something else. Does that make sense? So in addiction, those things disconnect. Okay. Some more fancy words. Recovery epistemology. So this is a model of recovery from addiction and from trauma. And it's a little bit conceptual. I work in an abstinence-based hospital. So what that means is you normally come with two problems. One is a substance abuse problem or a behavioural addiction problem, as well as trauma. One of the things that happens when you're using a mood or mind-altering drug is it affects your perceptions. If something affects your perceptions, it affects your ability to tell if something is true. Make sense? Okay. So what an epistemology is how we know something is true. Okay? So we start off with the body. We know something is true in our body through our sensations. Okay? Through our senses and our sensations. We know it's the lower level. Okay? We know something is true through our feelings. Okay? So what our feelings do is describe our relationships to people and also pets. But what our feelings do is describe relationships. Okay? And then we know things to be true through our thinking. If those three things align, there's a sense of wholeness within us. Does that make sense? Okay. When we are trying to treat a patient like Maddie, we are trying to get that sense where the body is agreeing with the feelings and is agreeing with your thinking. When we're treating eating disorders, the body is agreeing with the feeling, is agreeing with the thinking. And sometimes we have to change what we feel. Sometimes we have to change the body, and sometimes we have to change thinking. So we've got different kinds of interventions. We have CBT, we have EMDR, we have body work, we have breath work, we have a number of interventions. Okay? So oftentimes, as we meet somebody who's in addiction, we are trying to help them become whole so they can make a decision. Okay? Sometimes we need medications, sometimes we need other kinds of assistance. We're always looking for that sense of wholeness, for our body and our feelings and our thinking to align. The fourth part here is we know things by making choices. This is where recovery starts. I want you to think about relationships you have, friendships you have, if you're married. There's what you know about your partner the day you meet them, and there's what you know about them now. And you can say, I love you the day you meet someone, and you can say, I love you now, and it's not the same thing. The knowing of staying, working through arguments, working through misunderstandings, being a fair weather and a foul weather friend, it's a different kind of knowing. What we are looking for is the knowledge of a journey, the knowing of a relationship that is committed choice after choice after choice. If you imagine that Maddie has developed a relationship with alcohol, she now needs a different kind of relationship. Oftentimes this is where a 12-step fellowship will come and we'll have a community where there will be this kind of mantra, which is one day at a time. I'm not going to drink today. And oftentimes you sort of say, well, what about tomorrow? What about next month? What about next year? But it's really just today. It's making the right choice today, doing the next right thing. It's a different kind of knowing. The next part that we know things consciously and we know things unconsciously. So an example of something conscious, do you remember learning how to ride a bike? Do you remember what colour the bike was? Do you remember who held the bike? For those who don't remember learning how to ride a bike, do you remember learning how to drive? Okay. Do you remember the anxiety of it? Yeah, okay. So these are things that are conscious to us. We can remember them. If I prompt you, you can remember them. Do you remember learning how to walk? I can almost guarantee you fell down thousands of times. Your parents encouraged you thousands of times. You scraped your knees, you scraped your hands. You were frustrated. You don't remember any of this. But every morning you get up and walk. So your body remembers. So there are different kinds of memory. The body speaks. The body does many things. Some of them are automatic. Some of them we need to now remember. And I'm not going to say it's a reprogram, but we've mentioned with Mark schemas, there are memories that we hold that we've forgotten and now our body is speaking. Whether those are memories of I'm not good enough, whether those memories are people don't like me, whether those memories are there's many memories. I'm not loved. There's many memories. We can assume that those memories are truth until we learn how to speak them and think about them. We can know things as the narrative part. We can know things through stories. We have actually spent thousands of years with oral traditions knowing stories. It's only recently that we've become scientists or pseudoscientists. So you have a story. The story of addiction is potentially a tragedy. We want a story of redemption, let's say. But you have a story, your family has a story, your culture has a story, your church has a story. There are big stories, there are personal stories, there are political stories, which we're probably being assailed with in the news every day. We've got myths, we have fairy tales, and we have big stories. One story that we could think about is the story of Pinocchio. So Pinocchio is wooden and tells lies. So each time Pinocchio tells a lie, his nose goes a little bit longer. Everyone else knows that Pinocchio's lying. But he's wooden, he doesn't have a real heart. Pinocchio wants to be good, wants to be a boy, but has to do something before his heart becomes a real heart. That's the story of addiction. Everyone else knows. We all know. Look at your life. But you don't know you're lying. You have to be shown a different way. And lastly, we can know something through epiphany. The light turns on. For those of you who are GPs, you'll have this experience that you'll say, I think you should stop smoking. And nobody ever stops smoking. Because the light won't turn on until maybe you get lung cancer, maybe. You have a heart attack, maybe. We are always wanting for someone to have an epiphany. The epiphany is, you're the one I'm going to marry. This is the job I'm going to do. Oh, I'm a drug addict, I don't need to be anymore. We're looking for these sudden changes, but epiphanies are gifts to us. We can't make them happen. We can't make them happen for someone else. In Narcotics Anonymous and Alcoholics Anonymous, there's the idea that we come to believe. Suddenly you realise, I don't have to do this anymore. But you don't get it for free. You have to, I wish it was another way, but I think you have to go from top down. Make sense? So I work in a hospital with psychiatrists, counsellors, other kinds of therapists, psychoanalytic therapists, addiction medicine doctors, GPs. And Maddie would be a complex case, but quite a kind of common case in a way. I also work in Headspace with Mark, so I think if you can get in early and you can connect and you can be with a young person, it's not about fixing someone. It's really about kind of an attitude towards them. There's a couple of my Headspace registrars here. And And I think one of the most important thing for me is to teach how to be with someone. Sometimes people don't want to be fixed. Sometimes people don't want to be persuaded, and sometimes people don't want to be influenced. I'm probably one of those people, but I think most of us want an experience with being someone, being with someone, being with something that you believe in. What's my time like? 5 minutes? So Maddie's case is complex and layered. Connection precedes correction, and correction is a maybe. Compassionate curiosity opens pathways to change. So the problem of addiction is kind of basic in one way. There's only two problems. They're both feelings problems. You feel bad and you don't know how to stop feeling bad, or you don't feel good and you don't know how to feel good. Basically, all drugs and substances and addictive behaviours form one or both of those two functions. If we can figure out which function it is, and we can start speaking to that function, it's not as complicated as it seems. Most people, when they think about dealing with trauma or addiction, sort of get a little bit overwhelmed, but it's actually not complicated. Well, probably Maddie will be complicated, but the journey towards Maddie is not complicated. It just means that you need to think about what the feeling problem is. I think I might stop there.
Thank you so much, Andrew number 2. That was brilliant. Just so many big thoughts and feelings, and really appreciated just bringing it back to that we all can definitely empathise with those addictive impulses, whether it's scrolling on our phone or a substance, and just having more compassion and curiosity around having those conversations. So thank you so much.